What many Americans don't realize is that the moment they hear the words endoscopy or upper GI scope, they immediately picture a long tube being forced down their throat. But in reality, the experience is usually much easier than most people expect. Many endoscopy procedures are performed with sedation, which helps patients stay relaxed and comfortable throughout the exam. Doctors use a thin, flexible scope equipped with a tiny camera. It passes through the mouth, down the esophagus, into the stomach, and sometimes even allows them to examine part of the small intestine. We spend our days rushing to work, sitting in traffic, ordering takeout, and handling everyday responsibilities. Meanwhile, changes inside the digestive system can develop without causing obvious symptoms. An endoscopy gives doctors a magnified view of these areas, allowing them to look for inflammation, ulcers, or other unusual findings. Even more importantly, if something suspicious